Today, we're diving into what happens when the body's central command center, this tiny little gland with an enormous amount of power, decides to go rogue. Just think about this for a second. What if your hands, your feet, even the bones in your face just kept on growing long after you were supposed to be done? It's this slow, creeping process, and it all starts in a place inside your head that's no bigger than a pea. So, to really get what's going on, we have to meet the main character in our story today, the pituitary gland. Seriously, don't let its size fool you. This thing is the master controller of our entire hormone system. Yeah, you can think of it as the CEO of your hormones. It's telling all the other glands what to do, when to do it. It manages your growth, your metabolism, how you handle stress, pretty much the whole shebang. So you can imagine when something goes wrong here, the ripple effects are felt absolutely everywhere in the body.
Okay, so what exactly happens when this master controller starts to go haywire? Well, the most common reason is a type of tumor called a pituitary adenoma.
Now, I know the word tumor is instantly scary, but here's the most important thing to know right off the bat. These adenomas are almost always benign. That means they are not cancerous. But just because they're not cancer doesn't mean they're harmless. They can cause some major problems in a few very specific ways.
We can basically break down all the chaos these little tumors cause into three main categories. Think of it as three distinct flavors of trouble that this tiny growth can stir up.
All right, here's the breakdown. The trouble comes in three forms. First, you've got the squeeze. This is purely a space issue. The tumor is literally pressing on things. Then there's the silence, where the gland gets so squeezed that it just stops working properly, not making enough essential hormones. And finally, you have the shout, where the tumor itself is the problem, actively overproducing a hormone and sending one specific system into total overdrive.
Let's dig into the squeeze first. You have to picture this. The pituitary gland lives in this tiny, bony little pocket at the base of your skull. There is zero extra room in there. So as a tumor grows, it has nowhere to go but to push on its neighbors. And its most critical neighbor, the optic chiasm. It's like the grand central station for your vision nerves.
And the result of that pressure can be dramatic. I mean, can you imagine just losing your peripheral vision? You'd be bumping into everything. This specific pattern of vision loss, losing the outer half of your sight in both eyes, has a name: bitemporal hemianopia. And it's a classic telltale sign that something is physically pushing on that nerve crossing. It's often the first clue that sends someone to the doctor.
Okay, so that was the squeeze. Now let's dive into an example of the shout. This is what happens when a pituitary tumor just starts screaming out one particular hormone, growth hormone. When this happens in an adult, the condition is called acromegaly.
And this number right here, this is what's so wild. 7 to 8 years. That's the average time from when symptoms start to when someone actually gets diagnosed. You might be asking, why so long? Well, it's because the changes are just so incredibly slow and gradual. People end up bouncing from one specialist to another for years, complaining about things like headaches or sweating or sore joints before anyone connects the dots.
This is such a powerful detail. The change is so slow that sometimes the patients themselves don't fully see it until they look at an old picture. It's incredibly common for them to come into the doctor's office, pull out their driver's license from 10 years ago and say, "Look, this is what I used to look like. I don't look like that person anymore."
And these are the kinds of changes they're talking about. The facial features slowly get coarser, their hands and feet get bigger, they're often described as spade-like. They have to buy bigger shoes, their wedding ring doesn't fit anymore, their voice gets deeper and huskier because their vocal cords are actually thickening. It's this head-to-toe transformation, all driven by way too much growth hormone.
And here is the core paradox of acromegaly, and it's so important to understand. The body is building, yes, but it's building all wrong. The analogy of the wall is perfect. Imagine you have to build a wall that's twice as big, but you're given the same number of bricks. You're forced to leave gaps. That's what's happening inside the body. The heart muscle gets bigger, that's called cardiomyopathy, but it's a weak, floppy, defective heart. The muscles get bigger, but they're weaker. Everything is bigger, but it's also weaker.
So with all these strange, creeping symptoms, how do doctors finally nail down the diagnosis? Well, it's not a single aha moment. It's a very methodical, four-step journey that takes them from suspicion to confirmation. It all starts with that first step, clinical suspicion. A sharp doctor noticing the physical changes. Then they'll do a screening blood test for something called IGF-1. Now, why not just test for growth hormone? Well, growth hormone is released in these random pulses all day, so a single measurement is kind of useless. IGF-1, on the other hand, is nice and stable, so it gives a much clearer picture of what's going on. If that's high, they move to a confirmation test. They give the patient a big sugary drink. In a healthy person, all that sugar would tell the pituitaries to stop making growth hormone. But in someone with acromegaly, the tumor just keeps shouting and the levels stay high. The final step? An MRI of the pituitary to find the tumor that's causing all the trouble.
So, once the diagnosis is confirmed, the mission is clear. Get the body's hormones back in balance and silence that shouting tumor. And thankfully, modern medicine has a really impressive toolkit to make that happen.
The number one go-to treatment is surgery. And it's this amazing procedure where surgeons can actually go up through the nose to get to the pituitary and remove the tumor. It's way less invasive than you'd think. Now, if surgery doesn't get all of it, or if it's not a good option for the patient, then medications are the next step. And for the really tough resistant cases, there's a final option called radiosurgery, which uses these highly focused beams of radiation to target what's left of the tumor.
And the medications they have are pretty clever. They basically work in two different ways. One class of drugs mimics the body's natural off switch, essentially telling the tumor to just quiet down and stop making so much growth hormone. Another type works like a bouncer at a club. It doesn't stop the hormone from being there, but it stands in front of the body's cells and blocks the hormone from getting in and delivering its message. Two different ways to solve the same problem.
You know, when you look at a condition like this, it's just a powerful reminder that our bodies are this incredibly complex, finely tuned orchestra. Acromegaly shows us what happens when just one single instrument decides to play its own tune, way too loudly and completely out of key. It really makes you wonder, doesn't it? What other hidden instruments are playing their part right now? And what happens when they too go rogue?